So I will leave the floor for the students. I think first, Maryam, she will talk first, and then they will lead the discussion each other. But let me just, before you start, Maryam, Dr. Bashar, can you hear me? Professor Bashar? I think. Just hold a moment. Hello? Dr. Bashar?
Assalamu alaikum. Yeah,
Alaikum assalam wa rahmatullah.
I'm sorry, Dr. Muhammad. I seem to have problems with my Wi-Fi connection. I can hear you now. Sorry, akhi.
Now we can hear you also. Thank you.
Thank you, akhi.
Okay.
Oh, hi everyone.
So just before Maryam, I just want to inform everybody that the seminar is recorded, and we are going to use it for the future course evaluation and future assessment of the course, inshallah. So Maryam, you can start, please.
Okay. Hi everyone. I welcome you all to this seminar. So I think most of you know what is artificial intelligence, but let me tell you an introduction, and then we will go into the debate. Artificial intelligence is defined as a collection of the algorithms, machine learning tools, sophisticated neural networks, and systems that are changing how radiology services are delivered. Experts are claiming that the AI will revolutionize the major sectors of the world economy in coming decades. Perhaps nowhere is the AI transformation more promising than in healthcare, where the improvements can make a difference between the life and death. While the predictions of an AI future have caused some to worry that technology may one day replace the health workers, the reality is that the personnel in the field have skills which AI simply cannot replicate. Today, me and my colleagues are here to debate on artificial intelligence, which one group is going to support that the prediction that it will take over the job of radiologists is true, and my group is going to support that artificial intelligence is not about taking over or replacing. It's about reshaping the future. So I invite my Samia's group to start. Thanks.
Hello everyone, I'm Samia, and my group Ragad and Nariman will talk about the disadvantages. So the first disadvantage is basically errors. So artificial intelligence, we think that it makes a lot. It can make errors because it is powered predictive analysis, and it can identify potential illness, of course, faster than humans. However, because it is based on algorithms and on whatever humans installed in it before, it may have mistakes when dealing with the patient. This is because it lacks correlation between all the information and the history of the patient. If we talk about the humans, so basically when the patient come, the doctor correlates the previous information that the patient have, the history, with whatever the patient have now, the signs and symptoms, and then based on that they give a treatment and diagnosis as well. A recent report titled Artificial Intelligence, Bias and Clinical Safety asks that other industries' machines are often able to quickly correct themselves because of the algorithms, of course, because they have the ability to correct the mistakes. However, with dealing with humans, we talk about the life of the patient and the safety, and there is no room for making any mistakes. So yeah, this is basically our first disadvantage. Floor is.
I want to tell you something. You know, the first advantage of artificial intelligence is reduction in human errors. The phrase human error was born because human makes mistakes from time to time, okay? But computers do not make these mistakes if they're programmed properly. With artificial intelligence, the decisions are taken from previously gathered information, applying a certain set of algorithms, so errors are reduced and the chance of reaching accuracy with greater degree of precision is possibility. It means that if we program it, if we set the information, the algorithms, if we set the machine properly, it will reduce human error. And this is a fact. If you search on the internet, this is a fact that artificial intelligence would reduce human errors.
Yeah, I am. Yeah, because see, as I know that in the healthcare system, the workflow is too much for the radiologist, because we are the primary part. The radiologist and the radiographer imaging system are the primary part for the diagnosis. So when the workflow increase, the human mind will get tired, and this tiredness may lead to errors. But we have the AI here. The AI, as my colleague said, the first advantage of the AI was that it doesn't make errors as the humans. It's like, it's not that we say that, yeah, we give some information to it and then it will give us that. It's not about, if it was like that, there are many researchers, I have many evidences that it can detect a benign tumor. The humans created, but it can detect in the mammography some small benign tumors, and recently even in the brain, even in the chest, it has detected, and I have also the evidences. So it's not the errors in the AI. Everyone knows that technology makes less errors than the humans.
Okay, the percentage of hand of robot, it's more than the percentage of human candidates at hand of doctors. And also, if doctor make mistakes, he lose his job. But if it's a robot make a mistake, then what will do? Nothing. Just fix it, and buy it for fixed robot or programming, and it doesn't make any sense. Like basically, just we fix it, and we cannot put a human life like under hand of under dangerous. So this is a human life, so you can't make a mistake in medical.
As we are dealing with the humans, and for sure, before taking the robots or the artificial intelligence to the hospital or to the medical field, for sure there is some experiments on the artificial intelligence and on the robots, and we will 100%. The engineers, the person that they want to buy, or any person, they will not take the robot from the before experimenting on it and take it to deal with the humans with their lives. So for sure, 100%, they will minimize any error that might happen, even for 1% or 2% like this.
So you say that the person can make mistakes. So if person can make mistakes, so maybe the person forget to program a report to emergency so.
But there isn't one person who makes this artificial intelligence. It will go under process to examine that is it working properly or not. And because we are dealing with the human's life, so for sure it will be much more accurate than a person.
And see, we are not leaving the AI in a room to diagnose by itself. There is a radiologist to monitor everything. This was a good point that we will mention it more in the employment. The radiologist is there to monitor. The AI is giving a hint to the radiologist. The radiologist must be there to monitor. Radiology has studied for more than 10 years, so his mind works with the AI. The AI diagnose it, then it think of me as a radiologist. The AI will give me the diagnosis. I will check it. It giving me the hint. Yeah, there is a benign tumor. And from my information, from my 10 years of experience of studying, I will came to know into more detail. I will came to know what this benign tumor is. What's the illness is this? It's not like the point that you said makes no sense, because we have radiology. The healthcare system is not going to be free by itself in the hands of the AI. No one is going to do that.
Yes, you have a point, yes. But what is the point of us including AI if we will only help the doctors? Like it will be just doubling the work and doubling the money without the need for AI. Like what was happening a long time ago, before 100 years ago? There was no AI, right?
Okay, I will tell you now.
So, but yeah, there was no AI, but however, the doctors gave a good treatment for the patient without the need for us to use it. What is the need of us including AI and putting much money in it? And at the end, the doctors and radiographers with the whole healthcare team can give the treatment to.
Okay,
it's making the life easier.
Fatima, wait. Okay, the point that you said, you said that what's the use of AI? See, I said the workflow in the healthcare system will increase for a radio. Here we are talking about the radiologist. I will talk about the radiographer after this point. Radiologist. Okay. A radiologist has a shift of 8 hours without AI. Now think without AI. Diagnose. At some point, the burnout will happen. At some point, the tiredness. We are humans. We have senses. We have too much to think about. We have too many problems in life. And at some point, we will burn out in that 8-hour shift. Then AI came. Then AI comes. The technology comes. Now I'm relieved. Like the workflow is taken from my shoulders. Someone is here to help me, not to take over. Someone is here to help me that like, okay, this is a tumor. This is the tumor. I will take it, check it. Yeah, this is it. I will take it, check it. And this checking, this analyzing makes less burnout, makes you less tired than diagnosing by yourself, by your mind, every brain cell. Yeah, the AI is becoming your brain cell, the one who is. Your brain is not the enemy of you. It is helping you, and we see the AI as someone who is helping me, as the brain cells. Like if the radiologists in the past they were making good treatments, good diagnosis, because as we know in past there was no illness or this illness, that new illnesses that is coming every day, that are introduced every day. There was not, those things were not there. Now every day a new illness is coming. Like I'm saying, it's detecting a benign tumor.
And the other thing that we have to mention it is we wish that everything in our life we could buy it with money. For example, if we lost our radiologist regarding the hard workflow, or maybe he or she gets tired from the work that he is doing every day, and sometimes it's not 8 hours, it's more than 12 hours for the radiologist. For example, in some countries they have for the big countries, maybe they have 30 radiologists like this, and when they get tired they will hate their job. So it's better to have the AI beside of having the radiologist to help them in the diagnostic parts of the medical.
And
Exactly.
you mentioned, Sonia, and you mentioned about radiographer. No, the radiographer, no, the AI will not take the place of a radiographer, because why we are studying two courses of patient care, why we are studying the positioning of the patient. The AI will never do the positioning, the patient care that we have. In patient care, you will see the appearance. If I'm okay, we are studying the patient care, we have to see the appearance of the patient, we have to the assessment, the observation, the evaluation of the patient. Never the AI will do. The way that we talk to patient, never the AI will do. And the healthcare system will not replace the radiographer. Here we are talking about the radiology.
Okay, but first,
Now,
so
now you got what you
about
needed,
the
Samia?
radiology. Can I?
What?
So, yeah. So you first thing you said that about radiologists, that it will help them. So what is the use of the radiologist that he spent more than 5 years, of course, studying? It's more than 5 years to be a radiologist, to work and give the treatment to the patient. What is the use of adding artificial intelligence? Actually, you first of all, you just add work for him, because he will, for example, go do the surgery, angiography, or whatever, and then he needs to come back to his office and to go through all the artificial intelligence, or what the machine gave him. For example, as I said, it will give him that this patient has a tumor. So he needs again to go back and, sorry, there is an echo. Can you, yeah.
Listen,
So,
AI
AI
will make their life easier.
Yeah, can I finish first? So he needs to go. He needs to go and again go back. Of course, we can't 100% artificial intelligence and give the no, definitely no, because as we said, it can make errors. So the doctor again, he needs to go back and go through the whole patient history and patient information to make sure that this patient is getting the right treatment. You're just making him work much more and spend much more in his office. This is not improving any workflow or anything.
Samia, we cannot say that technology is useless in this world. You are saying that what's the use of technology? The AI is the tech. We cannot say that what's the use of the computers in our life. See now in the we are studying online. We need our computers. How much this technology helped us? You cannot say what's the use of this. You're like, if we have the computer, what's the use of the professors or the teachers then? Like you're telling this point, because the radio, I told you that the burnout will happen if the radiologist did it by himself. I told you that the radiologist's workflow will be decreased if AI is the. I'm checking. If I'm a radiologist, the AI will give me the diagnosis. I'm checking the analyzing process. It's not burning the brain cells in that 8-hour shift. Like Rakat said, wait,
to add artificial intelligence if it will only help in that option. It won't be used in other options, for example. So you will, it will cost you a lot to buy the certain machines that have artificial intelligence, and at the end it will just help the radiologist alone.
Because it's so accurate, because AI is accuracy. It's the center of the
And
accuracy.
also, it's not much more expensive than the radiologist health, the mental health, the physical health. It's not much more than that.
Exactly.
Okay, you talked mostly about the radiologist. You said also that the radiographer won't be affected. No, this is wrong, because lately I heard about a new technology, which is, I don't know in which country, but they did a new artificial intelligence machine that when the patient come to the, let's say, general X-ray, for example, they found a whole TV in front of them, telling them, like a robot, telling them to position themselves normally, like they do it themselves. So there is no radiographer actually inside the room. So basically here, you're gonna remove the radiographer job. What will he do after that? If you
the thing that I said, do you think this is a good idea? Do you think this is a good idea?
No.
So probably the healthcare system
leave
will
the
have
machine by itself.
no one will do that.
Do you think it is a good idea? Because it is
No,
included.
I'm talking about the radiologist. I didn't talk about the radiographer. I'm talking about the radiologist. So the study 7 years medicine and then specialize in the radiology, not about my future work of radiographer.
But what about the, let's say the radiologist, it is beneficial for them, right? This is your point, right? What about the other workers? What will you do about them? They will be
the debate is on radiologists. I will tell you about my research on the impact of the AI on the radiologist work, my research, and I have the research that the UK radiologists, 56% of the UK radiologists, UK, I'm telling you about the UK, were very happy about the AI because it helped them, the accuracy, the decrease of the workflow. There is many things, but these two things is always the most major points that they talked about. The burnout. Do you know, in the aid of my my colleague Safa, I want her to talk about this shifts, about the work, because I'm not in the clinical rotation, but I know her. She is there, she has work, and I will leave it to her to talk.
Yeah, as Samia, you are going to the clinical practices, really is a helpful thing, because human in the 24 hours, he or she is not going for working only. We have another things to do in our life. For example, we as a student, we have to study, we have to get prepared for the tomorrow's lecture. Am I right? So, of course, radiologists and radiographers, they have more things to do than us. So, it's better to not burn out.
Okay, you reached a point here also. So we'll go to another point, like related to this. So basically, AI will definitely like improve the healthcare, right? This is what you said. It will improve the healthcare.
It will reduce the stress and the burnout.
Yes, but also as long as it is improving the healthcare, also we as workers and as students, we need to be to get a higher qualification to be able to keep up with this new technology. So for me, this is an issue, because as I'm graduating, I will know that, okay, artificial intelligence is helping the doctors, for example, to do this job that I had to do before. But right now, I cannot do it because AI is taking my place. So I need to go and get more education and be more qualified. Maybe even I need to have a bachelor. Yeah, maybe I can even need to a PhD degree to be much more qualified. So this is a problem for me, because I wish.
So
first of all, and I will lose money as am I educating myself without having any job to work with.
Yes, you are right in this part, but for sure, even in our field, we have to increase our knowledge in any other parts. For example, when they found out the X-ray machine, it was just the mobile one, but now we have it, the another things, and every radiographer and radiologist, they are comfortable with it, and even in the newest technologies, they will be comfortable to it. And for sure, when we are going to work, they will, from the hospital or from the Ministry of Health, they will put the courses to learn. For example, I was in the American hospital. They had to buy a new machine, the new general X-ray machine, and they had the radiographers, they had course regarding how to work with the new machine. So this is the good point. Of course, we will have the courses or the something to learn about it.
Yes, it means that AI won't remove us from our workplace. Okay, Sami is basically saying that, okay, when AI comes, then we don't have a job to do it. But basically, AI won't remove us from our workplace. It will just automatically makes our life easier. It will let us have more. It will let us have more relaxation. We'll have more free time to do other jobs. We'll not be stressed. One of the benefits of AI is this, because AI will mentally and physically help us in our work, in our job. It will not remove us from our workplace.
No,
Samia, okay. You are talking about, okay.
Yeah, the last studies that have been done, they prove that some jobs will be definitely 100% they will be removed, because these jobs they mostly target the low and middle class of the community. These people who let's say, for example, I don't know what you said, for example, something dealing with the computer, that its artificial intelligence will correct its own mistakes. This job actually is done by a technician that knows in computer stuff and improves the quality of the system. However, now this job will not be there anymore. So definitely it will remove some people. The issue here is that what will you do to these people? How will they get an earning? How will they live?
Samia, can I tell you something? Okay, we are talking about the employment, not the radiographer, radiologist, because the AI now is impacting too much on the radiologist work. In my opinion, as I said, a radiologist, as we know, is a human who has studied for 7 years, 6 years of medicine, and then he became specialized in the radiology, in studying the X-ray, MRI pictures. So even the oldest people, the old people, older generation, always say the one who studies in the healthcare system or medicine will never lose his or her job. Because if you are a radiologist, you have studied the 7 years of medicine, means I have studied the family medicine, means I have studied the general medicines, means that even if the AI one day take over all of my job, that will not happen, then I can go to the radiotherapy, I can go to the chemotherapy. It's not going to take over anyone in the healthcare. The job of the healthcare, it just will change your path. You are saying about the earning. The one who have studied the medicine and then the radiology will never worry about the earning, because if the radiology is gone, then he can go to the family medicine, he can go to general one. But if this not happen, then he can study the chemotherapy, the radiotherapy. We cannot say that in the healthcare system. We cannot, even you can ask any doctor, if, when you visited any doctor, you will ask them that will you ever think that you will lose your job? They will say no. Even in this pandemic, no one in the healthcare system lost their job. Yeah, we know that. This is we cannot say that the one who studied medicine or the health sciences will ever lose their job. We cannot say. But yeah, I know it will change our path of our job. As I said, the radiologist, it will not happen. But if the radiologist is no, one day, if no radiologist is there, he can go and study the radiotherapy. He can go and become the I don't know, do the PhD and become the professor. There is many ways that you can do. You are telling me about the earning, and this was my point that I disagree with you about the earnings.
Yeah, so as you said, okay, then it won't affect the radiographer. It won't remove the jobs, of course, as you said, right? However, as in your including AI in the work, it will definitely reduce the salaries of the people, because then you, as you said, the radiologist now have an AI that help him in detecting the disease. So the hospital cannot pay him the same salary as he was paid before, right? Because they will tell him, we already paid a lot to buy you this machine that now is helping you to detect diseases. So why will we pay you the same salary as you had before? It can't be right. Also, as for us, the radiographer, if we include AI in our work, definitely this will reduce our quality of working, and it will affect us in the salary side.
Okay, let's think that a hospital comes to a radiologist and he will say that, yeah, I have put this much cost in the AI, now you are somehow useless to me, so I will decrease your salary. So a radiologist's work is not only to be there and to tell you the diagnosis. A radiologist is in contact with the surgeon. I have seen a radiologist is in contact all the time with the surgeon. He comes into the operating room. The AI is in operating room. He will tell you what to do, what not to do. Even in the surgery, we have the AI. But a surgeon is there who is controlling, who is doing that. No one will say that, because the radiologist still has some. AI cannot talk to a surgeon. AI cannot control that one. AI is only diagnosis part. We are making it too much big for ourselves. Yeah, that it will decrease the salary. Yeah, it will take over everything. As I said, it's not a human mind. It doesn't have the human feeling. It cannot be in contact every time with the surgeon. It cannot go into the operating group to help the surgeon.
But even though the radiologist's job is to actually diagnose the images, basically regarding whatever he's seeing, and by reading all the information he have, also by relating it to whatever the patient had before in the history. Because you cannot tell me that AI will be able to detect this, for example, you said before, this tumor. Okay, but this tumor, what does it have? Like, which is it hereditary? Is it due to I don't know, something that happened to the patient during his work? Is it
You are giving me the points. Yeah, I said that the radiologist is there to manage, to analyze. Yeah, I said that.
I'm still saying that artificial intelligence will detect the disease. We cannot really accept this or trust the AI to detect the diseases, for example, because definitely we'll need the radiologist to give his own opinion. And this is, for me,
of course the radiologist is going to monitor it. Of course he's going to check it. It's not like, okay, the machine is doing it, then we'll give the exact thing that the machine said to the patient. Of course it's not like this. A radiologist must check it.
Yes, you are debating on something that has been confirmed.
Exactly.
When you search AI, it says accuracy.
By the way, we searched a lot about disadvantages, not only you. We searched many days many days, we found many articles and many scientists. By the way, even the people who invested, this is out of the healthcare field, but even people who invested Facebook and Instagram, all the lately artificial intelligence machines and platforms and etc., they all say, if you want to search, they all say that we are not really trusting artificial intelligence in our whole life, even though they are the one who produced it. They still cannot trust it because it can make errors. It reduces the security of the people. This is another topic. My colleague Nariman will talk about it, the security, because this is a big issue as well. And if you come to me and include it in the healthcare field, that's contained patient information that is very sensitive, how will you deal with the security? And to my colleague Nariman.
Okay.
But this part that
Just
regarding
give me a moment, please. Hello. Okay. So now we have a group supporting the AI. The other group is not supporting the AI. We have 4 points. The point number 1 is that the AI is done by machines, and this machine can make mistakes. Then number 2, the AI is it can be a threat to the jobs, maybe for the radiographer or for the radiologist. And number 3, the AI is expensive. And number 4, as Samia said, the security. Okay, because we need to finish within the time at 2 o'clock. If anyone from the audience want to ask a question to the students, or if he or she want to add any point, feel free to do that, please, so we can make this debate more rich in knowledge and information.
Good afternoon, students.
Good afternoon.
So, yeah, of course, AI could play an important role in radiography, but there is a point that I expect you to talk about. Samia Group, there are some tasks the radiographer perform while AI never do it. One of these tasks is patient care and communications. So what do you think about that? What you can talk about patient care and communications?
Okay, this goes back to our thing that Samia said. It will remove us from our job. It will not remove us. As the doctor said, the machine doesn't have feeling, doesn't know how to talk. It's just doing its job. But a radiologist, he's going to monitor it. He's going to communicate with the patient, and he has feelings. He can talk, but the machine can't.
Let us focus on the job of radiographer, not the radiologist. Okay? Yeah.
Yeah, so as you said, Ms. Ridan, that's true. It will, this is actually another disadvantage. So artificial intelligence basically is lacking the interaction and the feelings, the emotions, everything that as human we have, it is lacking it. So definitely it will affect the diagnosis, treatment, and also as us with as a radiographer. Mostly our work is interacting with the patient. You like, for example, you welcome the patient in the room, you speak about, you explain the procedure so that the patient will be more comfortable in the examination. However, if we include AI, it won't do that, definitely. What will the patient feel if he have any question? Who will he talk to? Who will he get explanation from? The machines will not tell him, okay, you have to do this position. For example, let's say the contrast media, when we want to inject it, we tell the patient that you will have this side effects, this and this, it's fine, it's all right, if anything happen, we are here to take care of you. But if you bring the machine to give the contrast media and leave the patient like this, definitely he won't be able to he won't even like to do the examination. He won't be cooperative.
Okay, Samia, just a moment, Mariam, please. I want to hear from Saliha, please. Saliha, are you here?
Yes, I'm here.
Yes, please. Take your chance, please.
First of all, I wanted to mention that there is nothing called radiology without artificial intelligence. Sorry, but for diagnosing, we cannot every time cut a person and see what's going on. So, and definitely, as my colleagues already mentioned, we are not going to leave everything for the machines. There will be definitely a person who will control the machine and will contact with the patient.
Dr. Vajdan, you mentioned the point of the patient care at the first of our debate. The debate was on the impact on the radiology. But at the first of our debate, Samia also knows. First, I talked about the impact on the radiologist job, and then I said about the radiographer job that I'm studying. I told her that I'm studying 2 courses of the patient care, and no AI will replace my job. So this was discussed by us. We didn't even support the AI in the radiographer's job. We said that if we are studying 2 courses of the patient care, because we have to have an assessment of the patient, observation, evaluation. We are studying these things in a patient care. And no AI can even learn about these things when you don't have a feeling. Yeah, thank you.
Yeah, that's great. Radiographer are able to recognize possible communication barriers, adapting communication strategy to ensure our patient requirement, and make sure that the patient could understand what is involved. AI, difficult to replace, of course, radiographer responsibility. Thank you.
Yes, Prof. Ozan, please, Dr. Ozan.
Hello. Yeah, good discussion actually. I enjoyed, but I think I can put some comments regarding to first of all Fatima Sadeghi. Fatima told that computer cannot have any mistake or like a interpretation problem, right? So I totally
Not
disagree.
any mistake. They will have a low rate of mistake, not
No.
any mistake.
In this case, you need to think about the structure of the AI. So the existence of AI basically consists from 2 things, right? So first is their experience, second is their algorithms, and finally it's their diagnosis. So at the moment, we are giving some data for the AI algorithms with some structures that we create as a scientist. But this is the initial step of AI. The second step of AI, I am not talking about the radiology, by the way. The second step of the AI in the global science, that the AI algorithms will learn how to learn. This is the very critical point. They will learn how to learn, right? So because at the moment, we are providing the data, or we are providing the already diagnosed issues so they can differentiate. For example, you have a 100 diagnosed case. So what we are doing at the artificial intelligence, I am not talking about the machine learning or the regression analysis, just about the neural networks, for example. We are giving 80% of data. So the AI algorithm and architecture just trying to understand the relationship, considering the inputs and one output. So the second step of AI, maybe, I don't know, some years later, so they will learn how to learn. This was the first point. So at the moment, you cannot claim that the mistake rate would be very low in the AI, because it's also depend on us at the moment. It's depend on us as a data provider. So this is the first point. So the second point is, I think you need to extend your point of view, not about the employment or losing the job or job task or something. If you run around this subject, so you cannot catch the importance of this issue. Of course, of course, AI will replace the position of radiographers. No doubt. No doubt about this. You are saying that the robots don't have feeling or something, or cannot touch the patient. Excuse me, but these AI robots now having micrometer surgeries, right? Micrometer surgeries. How you can think that they cannot touch the patients? So impossible. So instead of having these employment issues, I think you need to catch the importance of AI with the new job titles. For example, trying to increase your awareness about data science, like data processing, or how you can involve yourself into these issues, right? So this is my kind of recommendation. Just try to catch this important issue regardless to employment issues, because you are already going to graduate. So, but sooner or later, you will be in the loop. And this is the important, from which part you will catch this loop or this game, let's say. This is a game. This is a game, but it's like a car factories. 20 years ago, the man was working in the factories, right? But even in the BMW, in the Mercedes factory now, from the 0 until 100%, maybe there is less than 1% of man touch to the cars. All is AI, all is the sensors, right? So this is the same situation with the radiographers. Instead of running around this subject about the losing job, what we will do, but you need to catch some role sharing, right? So yeah, but I like your opinions. These discussions really, they're all beneficial to have between you. I mean, thank you.
Thank you very much, Dr. Ozan. This is the first time to think to give this seminar in a different way, instead of someone just presenting and the others listening to him. We think that when we make it as a debate, first of all, the students or they will prepare themselves, they will read a lot, and then they will talk not from the PowerPoint, so they will come prepared with some kind of information, and it will help them and to help all the audience to understand the issue of or the game of artificial intelligence. Thank you.
Nice. Very nice.
Thank you very much.
I think in the second step, they can discuss in the which part or in the which step we can involve ourselves to the game of AI, either by data process or with like a software issues, or like writing some codes, or like Python or another codes. This should be discussed in the further steps. This is my recommendation.
Inshallah. Thank you very much. We have 11 minutes. We also ask the audience, please. Okay, Professor Bashar.
Assalamu alaikum. Good afternoon. Yes, I think I've enjoyed this discussion more than many other things I've attended this year. I really want to thank all the students, but of course I want to thank Dr. Muhammad. Really, this is very nice activity. I think Dr. Ozan also mentioned almost all the points that I wanted to mention, but so I just want to stress on two things. So Dr. Ozan also mentioned that the accuracy of these algorithms at the moment, some of them reliant on how much training we give them, which is absolutely correct. But when you say error, the probability of error, I think if you just compare a computer with a human, then definitely the computer would make less error in a mechanical job, not in the sort of jobs or activities we are talking about. Because at the moment, we're talking about the AI dependent on training until now. So that's one issue. When you talk about error, you have to define what kind of error really you mean. The second thing, I think if you have such a wonderful activity, maybe right at the beginning, you give 1 or 2 minutes about the sort of the more precise definition on what you are discussing, because the main role of AI at the moment is to really shift the routine, if you like, the simple jobs that take maybe 80% of the radiologist's time. So, you know, routine chest x-rays, they give them to AI, and that would free the radiologist to do the more complicated, the more difficult things. I think at the moment, right now, and it is very fastly changing, that is the main benefit of AI. A third point, as Dr. Rozan also actually mentioned it would be very good to look at other industries or other job professions, activities, and to see what AI has done. I think until now, so humans have been able to adapt and shift and modify their, if you like, working environment so that they don't lose their jobs in the department. And this is, you know, so you are students talking about these issues, maybe with some worry, but we are trying to also modify the curriculum and the training so that we tackle these issues. And that's you know, why humans have remained in existence while other creatures have not. So we are able to really adapt, and that's what everybody should be really concerned about, rather than just, you know, fearing the effect of AI. Okay, now I'll probably stop because Dr. Muhammad switched on his camera, so maybe he's telling me to stop. But I've enjoyed this very much. Yeah, thank you. Thank you,
Dr. Bashar. Actually, this seminar course, every time it surprised me, by the way. I took it for the last 3 semesters, and every time I think I decided, okay, I will not take it next semester, but I found something that I enjoyed this course. This group of students, I really enjoyed with them, although we had a lot of connection troubles at the beginning, but actually I also so happy that some of them, they are only in the first year, and they prepare themselves very well in each session, in each presentation. Most of them, they improved a lot in terms of talking, presenting. I criticized them very hard and very harsh, but they accepted my, but inshallah in the future they will do good. So I'm not sure if anyone want to say anything before we have 5 minutes before we finish.
I think Dr. Bian wants
May I talk?
Yes, please.
Assalamu alaikum. Good afternoon. It looks I missed the very nice presentation or the very nice debate because I just joined from Dr. Ozan talk and Dr. Bashar. I had an oral exam with Safa's group. Okay, the best part I feel in this presentation is a unique combination of the student. I see the 4th year student and I see the 2nd year student who are studying intro to MDI, and even the 2nd or the 1st year student who are not still started their department courses. This is a very unique combination, and we didn't see this combination in our courses before. So if we are talking about other courses, never will see this combination of the 4 years in one course. This will bring lots of interaction, will bring lots of even thoughts, and the combination of these type of thinking and type of information, it will give a great product. I congratulate the student, and mainly I will congratulate the 1st and 2nd year student. I don't want to ignore the Sami's group and the 4th year and the 3rd year, but this year, 1st year and 2nd year student, when they are talking about such advanced topic, it's a great effort from their side. Thank you very much. And thank you for the other student from the 3rd and 4th years. And I'm really sorry I missed the DESM. I missed the most important part, but I'm lucky that I joined at the end. Thank you very much.
Thank you so much. Thank you.
Thank you.
We need also to thank the other students who joined. I didn't make any announce. I just invited the faculty member and the clinical tutor, and they invited their colleagues. And this is also very good that to see some
Very
students
nice, yes.
they want to attend with others and with peers, and they will help them to do assessment to show that they are interested about what they are talking about. Thank you very much. Do you want to say anything, students?
As a last point, I can say something. I just remember my bachelor time, a small note. So in some moments, just I recognize that the blood pressure a bit increased between the students. So this is very nice.
Yes.
When I was in bachelor, I was second year something. The philosophy students from the university, 5-5, they got a big fight because of one was supporting Hegel's, another was supporting anti-Hegel's opinions, and it happened just side of us in the next table. So I just remember those moments because they were discussing scientifically, but suddenly the things changed as a fight. So it's also good that you are keeping your motivation on these discussions, you know. So
Doctor, it's in our blood. It's in the Persians' blood. Me, Safa, Fatima are all Iranians. We have to fight for our rights.
Okay, fine.
Is anyone teaching Mariam? Dr. Wiam, are you teaching Mariam?
Yes, I'm teaching Mariam and Fatima.
I talk too much in intro to MDI class. Yeah.
Not talking only, but also she is very experienced in sending emails. Yeah, both of them, they like to send lots of emails.
Don't worry, when they will come to the skeletal, I will cut the wings. Don't worry.
I need to leave, by the way. Thank you so much.
Thank you, man. Thank you very much.
Thank you so much. Thank you so much.
Thank you, everyone. I think now we come to the end. We need to stick to the time, 1 hour.
Yeah,
we
thank you. Thank you. This is
from your holiday. Thank you very much. Thank you, students.
Dr. Muhammad, Muhammad, thank you for everything. This course was really good. I thought that I will be too shy to speak, but it was so good. I'm not shy anymore. I can present easily. I think my other friends also, and I have made many friends. Samia, Safa, Raqat, Saliha, Narima, Fatima.
Very good. Excellent.
Actually, Mariam, this is the first time I'm listening to you. I thought that you are one of the graduated students, not as a first year student.
Thank you. Thank you.
Thank you.
Okay, thank you very much.
Thank you. Ma'as-salama.
Thank you so much.
Thank you. Thank you.
We enjoy it. Thank you. Thank you.
Okay. So, do you have any question? Do you have anything, seminar and MDI students, before we finish?
What's your opinion about our debate? Your opinion is more important for our mark.
Very good. I enjoyed a lot. I enjoyed a lot. Thank you very much. You did the good. I'm sure if we did it in the university in the future, it will be very good. It will be more interactive. It will be more.
Radiography next semester with you.
Inshallah. Thank you.
You will enjoy, Mariam.
Inshallah. Yeah, I know.
Take care. Take care. Bye.
Thank you. Bye.
Thank you, doctor.
Bye.
Thank you, doctor. Thank you, everyone. Bye.
Bye.